Yeah, good afternoon and welcome to the 17th TechNet conference in Panama City. So let's have our opening ceremony. We have small delays with the Vice Minister of Health. So we'll just start while she will come, that we'll have to take her opening remark. So we are welcoming here all of you again on this 17th TechNet conference in Panama. Both you participants who are in person and thousands of participants who are joining online. The conference planning committee this year has really worked hard and efficiently to make an agenda and structural organization that for you to reconnect and to share experiences and achievement and knowledges through an agenda composed of pertinent topics and fully aligned with the global context of immunization program. So be amazed for being here and be part of this extraordinary adventure of the TechNet that started more than 30 years ago. So join me to address our warm regards to the founders and those who contributed to the influence of this TechNet. So having said that, this year, the organizing committee has provided interpretation services that you can see here that are available in French, Spanish, and Portuguese. You will be provided with devices to make this connection, to facilitate that. So I please you at the end of each day, just you return them. Finally, I'm kindly ask the speakers and the future facilitators to pay strict attention to the timekeeping because we have really a tough agenda. Now, having said that, I wanted just to introduce our speakers, starting with Dr. Anna Rivière-Cinnamond, PAHO representative of Panama. Anna, please, your opening remarks and blessings for this conference. Sit there.
Well, thank you very much. It's a pleasure to be here. I know that it has been a very tough work to make you all come here. And I'm really, really glad to see so many people. And of course, as usual, I would like to first thank the government of Panama and the Ministry of Health for the excellent work they've been doing in hosting these international conferences, but many others. It's been a hub for regional conference lately, which is a very good thing for Panama. And especially also the Ministry of Health to be always as responsive as they are. The minister and the vice minister are always very supportive of the work of WHO and PAHO. I would like to thank also all the participants, and particularly Kate O'Brien, IVB Director in WHO headquarters, Garry, the Director of UNICEF here in the Latin American region, Yvette Berrio, who's the Vice Minister, who's going to come due to the magnificent traffic that we always have here in Panama. I think you might not suffer it because you're in the very nice Sheraton, but definitely it's something that we have to deal every day with. Dr. Daniel Salas, who's the Executive Manager of the Comprehensive Immunization Program at PAHO. And all of you who have been coming from many other different countries and organizations, thank you very much to be here in Panama. I know that it has been a quite long way for most of you. So as opening remarks, I'd like to mention that this region has been a leader for the past 40 years in terms of what is the elimination and control of preventable diseases by immunization. And this has been done in particular thanks to the work that has been performed through technical cooperation, and particularly through the extended programs of immunization throughout the region and at global level. This cooperation has been coordinated and has been based on strategic alliances that are looking at reducing in a sustainable and equitable way what's morbidity and mortality associated to vaccine-preventable diseases. And the objective is to improve the quality and the life expectancy of people and population in our countries. We've done a lot of efforts, but most of the goals that we've reached in the past decades have been a little bit diminished due to the COVID pandemic, not only because there has been a limitation in terms of access to many services, including vaccines, but also because there have been new challenges such as infodemia and plenty of social media, which has been going against all the things that vaccination has been working towards in the past centuries, actually. Immunization has a lot of benefits for health, and this is something that we have to highlight and we have to counteract in terms of the infodemia that we've been confronted to. So I think you know better than I do that immunization and vaccination is one of the most cost-effective strategies and has a lot of benefits for health. And what we need now is to think about innovation strategies and approaches and best practices that could be implemented through strategic lines that could strengthen, for example, governance, or improving what's the follow-up of vaccination coverages, or even integration of those EPI programs into what is primary healthcare. The idea would also be to strengthen human resources for health, and obviously try to find evidence-based information to help orientation of decision-making and political decisions. We are very happy to see the TechNet conference coming back to the region after 18 years, and really glad to see so many people here. And that actually strengthens the compromise that we have with vaccination services and immunization programs. We would like to see improvements in cold chain, in supply. We'd like to see improvements also in logistics around the world, but especially in countries, in developing countries. I think in the next days, the exchange of information that you will have during the different sessions regarding the vaccination processes will help most EPI programs be confronted or have a new strategy to improve the way they work in this post-pandemic world. And the idea would be also to focus on equity and sustainability, which are two of the pillars that we should actually target. I hope that each of us, with the role that we have in each of our programs and our countries, will be able to share the perspectives and the ideas that we could do and we could implement to revitalize what immunization programs are and see immunization and vaccination programs as regional public good. Thank you very much, and I hope that you have an excellent meeting here.
Thank you, Dr. Anna. Now I'm just showing on video the opening remark from Jarbas, Barbosa's Director of PAHO.
Honoráveis autoridades del Gobierno de Panamá, distinguidos representantes de los países participantes, de la academia, de la cooperación internacional y otros actores relevantes. Es un gusto darles una cordial bienvenida a la región de las Américas y a la ciudad de Panamá. En el 2006, 17 años atrás, nuestra región fue anfitriona por última vez de esa relevante conferencia, la cual ha buscado, desde su establecimiento, fomentar el trabajo en conjunto para que todas las personas tengan acceso equitativo a las vacunas. Hoy, agradecemos a Panamá por ser el anfitrión de la 17ª conferencia de la TechNet, donde las innovaciones en cadenas de frío, suministro y manejo de vacunas y los enfoques para mejorar la distribución de vacunas son algunos de los temas que se discutirán para ampliar los servicios de inmunización a todas las personas. La región de las Américas ha sido pionera en la eliminación de enfermedades prevenibles por vacunación, como la viruela, la poliomielitis y el sarampión. El Programa Especial de Inmunización Integral y el Fondo Rotatorio para el Acceso a las Vacunas de la Organización Panamericana de la Salud han facilitado exitosamente a los Estados miembros el acceso equitativo a vacunas y suministros relacionados. El Fondo Rotatorio de la OPS ha provisto por más de 40 años acceso a vacunas e insumos seguros y de calidad a precios asequibles a los Estados miembros y territorios en la región. El Fondo Rotatorio brinda además cooperación técnica en análisis de mercados, planificación de la demanda, asesoramiento en logística, procesos de adquisición y comunicación estratégica. Apesar que la región de las Américas ha sido líder en inmunizaciones gracias a estas iniciativas, el impacto en el acceso desigual a la vacunación que se agudizó durante la pandemia por la COVID-19, sumado al encomiable esfuerzo de los sistemas sanitarios para mantener los servicios esenciales de salud, hizo que nuestra región reportara una caída considerable en las coberturas de vacunación, dejando a millones de niños y niñas desprotegidos y vulnerables ante enfermedades como el sarampión o la poliomielitis. Let me now switch to English. The intensification of countries' efforts to recover vaccination coverage has led to a significant increase in vaccination coverage rates in 2022. For example, for the first dose of the vaccine containing diphtheria, tetanus, and pertussis, which is usually a tracer of immunization coverage, has increased to 90% versus 86% in 2021, and the third dose of this vaccine has increased to 83% versus 81% in the same year. Similarly, with the aim to respond in a timely manner to the COVID-19 pandemic, together with our partners and collaborators such as Canada, Germany, and the United States, we were able to support the national immunization programs to expand their capacities in the areas of vaccine storage and distribution, with the acquisition of more than 600,000 cold chain equipment over the last 3 years, investing close to $17 million. However, all of these efforts are insufficient, knowing that there remain children, adolescents, and adults without access to vaccination. Sustained work and investment in national immunization programs is needed to ensure they are equipped to respond to evolving needs with a robust vaccine distribution platform, to increase vaccination coverage, and reach the most remote communities in a timely manner. I am therefore very pleased that today we can come together with representatives across various sectors to discuss the lessons learned from the pandemic and together find a ways to help ensure that vaccines reach everyone, leaving no one behind. I wish you a fruitful conference. From the Pan American Health Organization, we reiterate our technical cooperation in support of the network's initiatives. Muchas gracias. Thank you very much.
Gracias. Now we will have the video address for opening remarks from Kate O'Brien, the Director of Immunization and Vaccine Department, WHO Geneva.
Welcome to all, and thank you so much to the host region for welcoming all participants at the TechNet conference. My name is Kate O'Brien. I'm the Director of the Vaccines and Immunization Department at WHO in headquarters. I really want to welcome all of you to this first face-to-face TechNet conference since 2017. There was, of course, a conference in 2020, but that was online when we were all locked down as a result of the pandemic. And this year's theme is immunization programs that leave no one behind, which could not be more relevant for the world in which we find ourselves in, a world learning from the COVID pandemic. I want to deeply thank our Panamanian hosts, excellencies from the Panamanian Ministry of Health, Ana Rivière-Cinnamond, the PAHO representative of Panama, and our distinguished leaders from the region, Dr. Jarbas Barbosa, the director of PAHO and the WHO Americas region, and Dr. Garry, UNICEF regional director for Latin America and the Caribbean. Thank you so much. The TechNet platform has a long heritage. It's a tradition since 1989, a unique and long-standing and successful collaboration between WHO and UNICEF. It's been a beneficiary of support for all these years from the Bill and Melinda Gates Foundation, and that has enabled it to thrive in a constantly evolving space. And this year's conference is really a magnificent manifestation of the need for and the creative way that TechNet has evolved. It's evolved from an immunization supply chain policy formulation to providing a much broader opportunity to bring together all immunization stakeholders to build relationships, to share knowledge, to coordinate activities, and to align priorities and goals. The agenda for this meeting is amazing. And it's uniquely important. It's the 17th in an unbroken line of bi- and triannual conferences that stretch back, as I mentioned, to 1990. Now, a cross-partner initiative is coordinated now through the Gavi Alliance's Immunization Supply Chain Steering Committee. Some of you know it as the ISC2. So that has been a new initiative coming out of the start of TechNet and the TechNet conference. And this conference is a unique event in the immunization landscape. It's the only one that focuses on immunization supply chain, but does so in a way that puts it in the wider context of immunization service delivery and national immunization program management. The TechNet conference is the most important event at which we promote the uptake in immunization supply chain innovations and best practices. For example, previous conferences have been really critical and instrumental in rolling out innovations that we now take as norms. Things like the vaccine vial monitor, the VVM, or controlled temperature chain, CTC, or freeze preventive vaccine carriers. Also the solar direct-derived vaccine refrigerators. And those could not be more important as we go forward, as well as local and remote cold chain monitoring devices. When you think back, each of these was an innovation that needed to be scaled. The conference is uniquely inclusive. It has representatives, all of you, from all sectors: Ministry of Health, intergovernmental organizations, non-governmental organizations, academia, and very importantly, the private sector. More than 70 countries and 70 organizations are represented by all of you. And this conference in October of 2023 is particularly timely. A face-to-face TechNet conference is overdue. Again, the last one taking place in 2017. And we have just around the corner the 50th anniversary of EPI, 50 years of the expanded or essential program on immunization. That 50th anniversary will take place in 2024, and we hope to celebrate it throughout the year. And Immunization Agenda 2030, our collective worldwide strategy on immunization for the decade, is now well underway in its implementation. We have COVID-19 and lessons learned that we need to double down on. We have the big catch-up, and this will be covered in more detail, to catch up, restore, and go further coming out of the pandemic. We have unprecedented prioritization in cold chain equipment through Gavi's cold chain optimization platform and Gavi's comprehensive vaccine management, or CVM, approach. And of course, central to everything, the climate crisis places an ever greater spotlight on the environmental impact of immunization programs and the need for these programs to adapt so mitigation and adaptation. And so we have a deep need for environmentally sustainable immunization programs that can mitigate the carbon emissions that we put out, and it's becoming ever more important. This will be a key theme at this conference. In closing, I want to wish all of you best wishes for a really productive and enjoyable conference, and to leave with even more energy, even more curiosity, and even more intention for impact as you're coming with. Your work could not be more important, and the world is counting on you. Thank you so much for the opportunity.
Thank you, Dr. Brian, for the blessing. Now, I want to call Garry Conille for the opening remark. Garry is the Regional Director of UNICEF LACRO. Garry, over to you.
Thank you. Thank you so much. Ladies and gentlemen, good afternoon and very warm welcome to all of you. I extend, of course, my greetings to the delegation of the Ministries of Health, esteemed colleagues from WHO and UNICEF, representatives from PATH, JSI, the Clinton Health and Access Initiative, the Bill and Melinda Gates Organization, Gavi, academia, and manufacturers who have gathered here today. I would like to begin by recognizing TechNet 21 for the instrumental role it has played in advancing immunization practices and improving vaccine coverage worldwide. Its collaborative and knowledge-sharing approach has made a significant impact on immunization programs, ultimately saving lives and reducing the burden of vaccine-preventable diseases. I would also like to offer my best wishes and heartfelt congratulations to the dedicated members of the TechNet 21 Planning Committee for bringing us together at this critical moment. We convened to advance the Immunization Agenda 2030, marking the halfway point of the implementation of the Sustainable Development Goals. It is indeed a remarkable occasion as after 17 years, the TechNet conference returns to Latin America, hosted here in beautiful Panama. Our last meeting in 2020 was virtual amid the global spread of COVID-19. Today, the progress made in combating the pandemic allows us to meet face-to-face, and to date, 13.5 billion COVID-19 vaccine doses have been administered worldwide, with 71% of the global population having received at least one dose. However, it is vital to stress that we must not become complacent. The COVID-19 pandemic, along with its associated disruptions and vaccination efforts, has strained healthcare systems globally, resulting in significant setbacks in childhood immunization coverage. In 2022, a concerning statistic emerged. 3 in 20 children missed out on vital vaccines, leaving them susceptible to vaccine-preventable disease. This translates to 20.5 million under-vaccinated children worldwide, of which 14.3 million are considered zero dose. So although we have begun to recover lost ground in the past year, the restoration of routine immunization has been uneven, with low and middle income countries still facing challenges. The choice of Latin America and the Caribbean as our meeting location is particularly timely and necessary. Over a little more than a decade, this region has suffered setbacks. Currently, an alarming 2 million children, approximately 1 in 4 children under the age of 1, remain unprotected from vaccine-preventable diseases in the region. Shockingly, nearly 1.2 million of these children have not received a single vaccine dose. These children and their families often suffer from multiple deprivations. Immunization is an important entry point to addressing these deprivations. Under-vaccinated and zero-dose children are disproportionately from the poorest families, often residing in urban areas facing insecurity, violence, or within Afro-descendant and indigenous communities with limited access to healthcare and other social services. These children are located in areas that are difficult to reach, where gender barriers actually still exist. And furthermore, as it was said, climate-related events, violence, urbanization, instability, and migration have actually exacerbated inequalities in our region. These pressures, coupled with the lingering effects of COVID-19 pandemic, have strained political commitments and health expenditures, resulting in regression and leaving marginalized communities without access to quality primary healthcare and life-saving immunization. Now, at UNICEF, we are working closely with many of you in Latin America and the Caribbean to enhance and expand immunization coverage with the ultimate aim of making SDG 3 a reality. We are actively implementing the Immunization Agenda 2030 and the operational guidelines of the immunization supply chain. Our immunization initiative focuses on 4 strategic areas. First, increasing demand for services to address factors influencing the intent to use vaccination services, and for LAC, of course, this means more effective local level partnerships to implement a multifaceted approach that considers the unique needs and challenges of different communities. Collaboration among healthcare providers, community leaders, and organizations will, of course, be essential to our success. Additionally, monitoring and evaluation of these strategies will help assess their effectiveness and make necessary adjustments. Second, enhancing vaccination service readiness to overcome systemic barriers, as well as improving community access. Now, this means working closely with healthcare providers, policymakers, and communities to plan, implement, monitor vaccination programs, identify areas for improvement, and ensure that healthcare facilities are well prepared to deliver immunization services efficiently and effectively. Third, creating an enabling environment that influences contextual factors in favor of immunization program performance. In other words, it means supporting sustained efforts and collaboration across sectors and community engagement. It involves addressing not only health-related factors, but also social, economic, and political determinants that influence vaccination programs' performance. And of course, last but not least, investing in research and innovation. This is an important part of our meeting here today. Our collaboration with partners had led to promising and innovative initiatives such as human-centered design for behavior change, the digitization of immunization supply chain systems, and the quantification of resources required to reach under-vaccinated children. At UNICEF, we strongly believe that it is only through collective efforts that we can get immunization back on track. This is why we remain committed to TechNet 21 partnership and its critical role as a platform for knowledge exchange, capacity building, and collaboration among individuals and entities involved in immunization programs. And finally, I want to express my gratitude to each one of you for joining us here in Panama for this crucial conference. As we move forward in the coming days, I hope that our discussions will inspire and reinforce our determination to advance this shared immunization agenda. Leaving no one behind is our collective commitment, and the health and future of our children absolutely depend on it. Thank you very much.
Thank you, Garry. And now I'm inviting the host country for the opening remarks, Yvette Berrio, the Vice Minister of Public Health of Panama. I think for the
Muy buenas tardes a todos, distinguidos, invitados, colegas, amigos. Es un honor para mí darles la bienvenida a esta conferencia a nombre del señor Presidente de la República de Panamá, Laurentino Cortizo Cohen, a nombre del señor Ministro de Salud, el doctor Luis Francisco Sucre, y a mi nombre personal. Nosotros queremos agradecer a la Organización Panamericana de la Salud por todo su apoyo, por el acompañamiento y por la organización de este evento. Este encuentro de vital importancia titulado Los sistemas de inmunización en un mundo post-pandémico, recuperación, equidad y sostenibilidad, me lleva a reflexionar que en los últimos años el mundo ha enfrentado desafíos sin precedentes, con la pandemia del COVID-19 como un recordatorio doloroso de la importancia de la inmunización. Debido a la COVID-19, se han interrumpido los servicios de inmunización rutinarios de muchos países, lo que aumenta el riesgo de brotes de otras enfermedades prevenibles por vacunación. Con respecto a las vacunas del COVID-19, a pesar de los esfuerzos globales para desarrollar y distribuir vacunas seguras, eficaces, en tiempo récord, la realidad es que hay una enorme disparidad en el acceso a las mismas. Por ello, la innovación en la fabricación y distribución de vacunas, la monitorización en tiempo real de la cadena de frío y la implementación de sistemas de información eficaces son ejemplos de cómo la tecnología puede impulsar la eficiencia y la equidad en la inmunización. De igual manera, garantiza la sostenibilidad de los programas de vacunación rutinarios al mejorar la gestión de recursos y reducir el desperdicio. Me permito compartirles que nuestro país, Panamá, en el año 2022, recibió el premio al servicio público otorgado por la Organización de las Naciones Unidas en la categoría Resiliencia Institucional y Respuestas Innovadoras a la Pandemia de COVID-19, por la iniciativa Sistemas de Información de Vacunación contra el COVID-19, Panavac 19. Señoras y señores, estamos en un momento histórico y una oportunidad única para transformar nuestros sistemas de inmunización y hacerlos más equitativos y sostenibles. Espacios como este son muestra de las acciones que como equipo debemos promover para aprender de nuestras experiencias y fortalecer nuestros sistemas de inmunización, pues la evidencia científica establece que las vacunas salvan vidas. Muchísimas gracias por su atención. Nuevamente le damos la bienvenida a nuestro país, esperando que este tiempo sea de provecho para ustedes como profesionales de la salud, pero sobre todo para sus países, para nuestras regiones, para que nadie se quede atrás. Muchísimas gracias. Dios les bendiga.